for youth especially, we find that whenever we talk about mental health issues that they're facing, they talk more about self-esteem, so having low self-esteem, low and facing identity crisis, low sense of self-care, risk into sort of self-harm, and we also now, youth, we're seeing a lot of suicide among newcomers, or youth talking about suicide when it gets to the extreme cases. And then there's variation by different newcomer youth groups itself. Some are much more vulnerable. So if you look at youth who came as refugees, who've experienced protracted forced migration or living in refugee camps or traumatic events, then trauma-related mental health issues, where PTSD including, becomes very prominent. Second most important risk factor is, I'll sort of lump them together, they're all related. It's discrimination, particularly racism and race-based discrimination, social isolation and social exclusion. They're sort of all connected. If you look at LGBTQ newcomer youth, again, they may experience higher rates of depression, suicidal ideation, and so forth. So they become even more high risk. We found from our research that the main cause, the main systemic cause and risk factors to the mental health issues that newcomer youth face is the poverty and economic marginalization that newcomer families face. I would say that that's a major gap. We need better coordination, better networked system of support, mental health services and programs for youth, so that youth can easily find out about the different services and programs through other youth, or through, even if they connect to any one settlement worker, any one professional provider, they'll sort of automatically be able to learn about all the different youth programs, especially mental health programs that are available. In order to overcome these challenges, we have to pay extra attention then to the quality of youth services and especially youth-focused mental health services. It can't be just generic mental health services, right? We have to look at how to make it more youth-sensitive, youth-friendly, that tries to overcome these three challenges that I mentioned. Some of the current, our own evidence when we talk to youth about, okay, what, both when we ask them what do they do when they face sadness, or they're facing depression or mental health issues, a lot of youth still say most youth, when we ask what they do when they're facing mental health services, say that they either pray, they sleep it off, or they cry when they're feeling down, right? Accessing mental health professionals or mental health services is still not very common among youth. We need to reframe and reorient our services to make sure that youth can learn more about it, can feel comfortable using it, and can benefit from these services. In order to do that, there's a couple of things we have to keep in mind, so a couple of principles. First is that we need more, what I would call more seamless integration of mental health services with other services, right? So just the word mental health, there's a lot of stigma attached to it. And sometimes when it's translated in different languages, the stigma is even accentuated, right? So what we need to do is we have to sort of indirectly or seamlessly integrate mental health programs and supports within mainstream programs whether it's settlement, housing services, employment services, or in the school especially, right? Like even in recreation programs, in the soccer program and after school programs, if staff have some training around how to talk about, how to address, how to identify mental health issues that their youth clients are facing, then some of the issues they may be able to actually address it, even though they may be a soccer coach. Sometimes all that youth need is someone to be able to talk to, right? And they may be able to provide that support. But if not, they may be able to identify youth that may be at risk at facing certain mental health issues, whether it's depression or trauma, and be able to make the right referrals in a very sensitive way. And if youth trust these other providers, whether they're, again, doctors or a coach or a teacher, and someone who they trust can say, look, in a very youth-friendly way, that what you're facing is a little more serious, and that there is a lot of good support system in Canada for you to be able to talk about it, and I can make a referral. So if that can be integrated, again, seamlessly across all programs, I think we will be able to overcome almost all of the three challenges that I mentioned about youth not even knowing that they have mental issues, not being able to talk about it, not being able to access services, right? There are good programs like Y Connect, youth assisting youth that have good track record of showing that it actually works, and it's youth really value that. It's just that we need more of this. Every agency should have a youth-friendly space that newcomer youth can come and just chill out. That's the word that a lot of newcomer youth always say. We just need a place to chill out. It doesn't matter how we're doing in school. It's a place to just hang out and have fun things, do fun things, meet other youth, right? It's youth-friendly space is so crucial for young people, because every other space apart from school is very adult dominated, right? Like so having that space is very important, both in terms of just chilling out, relaxing, and meeting other people.